talking about individual personalized care, where the records are where the person is, location, 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 where the culturally appropriate approaches were being taken, where people could go and not have to travel distances to go from one doctor to the next, but that the community health centers were central. And that's why we, not only in the Affordable Care Act, but in the Recovery Act, we had bricks and mortar as well as programmatic funding increases for community health services. But we know that, want to hear for the community health centers? We know it's essential to prevent chronic disease in order to bring down health care costs, but more importantly, to have a healthier America, because it is, as often said, it's about diet, not about diabetes. It's about prevention, not so much, and wellness, not so much as correcting what has already happened. We know whether it's heart disease, cancer, stroke, diabetes, affect nearly every family, accounting for 7 to 10 deaths and nearly 75% of America's healthcare funding. Put simply, we know that prevention is so important. It improves the quality of life. It saves money for families, for governments, for hospitals, and doctors. The APHA has a clear promise, and you have my clear promise. We will stand firm to protect the investments in prevention and wellness. That is an absolute fact. We will fight those who want to overturn the Affordable Care Act and all that it has in there to keep our country on a healthier path. And one way to uphold our pledge to health care across the lifespan is, simply put, to secure, preserve, and strengthen Medicare and Medicaid. Too often they have come under attack and the truth has gotten lost. But the facts are these. Healthcare reform in the Affordable Care Act, we extended the life of the Medicare system nearly a decade. They said you took money to pay for Obamacare. Not a fact. Not true. The funds that were taken from Medicare stayed with Medicare. They weren't taken, they were redirected to prolong the life of Medicare for 10 years. Those who have criticized that approach took the same money and gave tax cuts to the wealthiest people in America in their budget. That's plain wrong, and we will fight that. So in the Affordable Care Act, we extend the life of Medicare for nearly a decade. We give seniors now have access to preventive services like mammograms, annual checkups, free of charge, a wellness visit, and we're cracking down waste, fraud, abuse, of course, always, and directing funds away from insurers and toward Medicare beneficiaries. That's what we did for Medicare in the Affordable Care Act. We do not, as others do in their bill, sever the Medicare guarantee. We will never do that and turn it into a voucher. That's just not a guarantee. We'll never, ever let this happen. I think it's really, and of course we all know, and nobody knows better than you, the importance of Medicaid and how turning it into a block grant and shrinking its size is a very bad idea for children and other living things in our society. So we will fight that as well. These are all on the ballot. The Affordable Care Act is on the ballot. Medicare is on the ballot. Medicaid is on the ballot. They're all on the ballot come Election Day. But I'm not going to talk politics here today. Let me instead talk history. When President Lyndon Johnson signed the Medicare bill, it was very interesting. He had President Truman and Mrs. Truman there, and he gave President Truman so much credit for having the idea, and then he said, I have the privilege of signing the bill, but I want to pay tribute to you because you, Mr. President, started all of this. It actually started at the time of Social Security, but they couldn't get them both done at once. But here's what President Lyndon Johnson said at the time. You tell me if this doesn't hold true today. He said, as he signed the bill, no longer will older Americans be denied the healing miracle of modern medicine. No longer will young families see their own incomes and their own hopes eaten away simply because they are carrying out their deep moral obligation to their parents. He then goes on to say grandparents, aunts, and uncles, and all the rest. But he also said that this honors the country that we are, to be fair to our seniors. The same spirit, the same moral obligation rests at the center of the Affordable Care Act and Medicare and Medicaid. It drives APHA's work to promote prevention and wellness across the lifespan. It carries then out the fulfillment. It fulfills the promise, as I mentioned earlier, of our families. I talked about life pursuing their own happiness. Life, a healthier life, liberty, the freedom to pursue their happiness according to their talents. Life, liberty, and the pursuit of happiness. Our founders promised that. The Affordable Care Act makes that more possible for people to live their lives in that way. Together, we must move forward for the well-being of our families. That's why I was so excited when I got the invitation to bring greetings to all of you. Many groups meet in San Francisco, home of the San Francisco Giants. And I thank you for having a nice orange trim on your tote. I can see it just glowing back from the crowd. And usually I'm on the road or something, this being election time, but I said, this is one group that I have to come and express the appreciation of all the people we work for, to you for being on the front line, for being a source, again, an intellectual resource about what the right approach is to being a dedicated source of concern for the American people. I think you're just wonderful, and I wanted to come here and say that as I welcomed you to San Francisco. So keep up the good work. Good luck in your conference. I know that many wonderful ideas will spring from it. I look forward to hearing how you're going to move us all forward. I wish you much success, and I salute your leadership, Dr. Benjamin, of course, and Dr. Shipp. Thank you all very much. Welcome to San Francisco. Go Giants. Thank you all.